Morning. Welcome to day 62 at Quantum's Liberty. Good morning, buddies. Hope this day is finding you well. Today, at the Quantum's Liberty DeStress series, we have, is there water? We have Teddy. Teddy's dad is a respiratory therapist in New York. And today, we're going to be talking about what Teddy's going through in New York. We'll start tapping. This is the DeStress series. So what we'll be tapping on is the, turn that off, a little bit noisy. Today, Teddy, he's 16 years old, and his dad's a respiratory therapist in New York. And we were talking a little bit about people not wearing masks and things like that in the face of the coronavirus. And so since we're tapping on de-stressing around the news, then we will tap on how that feels to see people not wearing masks in the face of coronavirus when he's watching his dad. And he's 16 years old, so he gets like the science behind what his dad's doing and behind what the governors are doing to protect the people. So some of the things that we were discussing was that that kind of apprehension Teddy was saying about seeing people without wearing masks when he knows what his dad has to go in and help all these people. So so we were talking about the way that he can help is that he can spread the word on what the science is, and he can tell people about what his dad does in the ICU. And one of the beautiful things that just came out, I'm not sure how long this has actually been out, but it's been more in the news about what ICU, keep on tapping, what ICU capacity means. And so some of the good things, of course, that are happening, thank goodness, is in record time. It's amazing. The fastest a vaccine has ever been developed. The last one was mumps vaccine. That was 4 years in the development. So for us to turn around this whole world and create a vaccine in a year or less, really, is monumental. It's wonderful. So one ICU nurse, Sandra Lindsay, was one of the first. She might have been the first to receive the vaccine in New York yesterday. And another ICU nurse said, "I feel like healing is coming." So those are wonderful things. Now, the other thing that we still have to do is we still have to maintain our the things that we can do according to epidemiologists and to scientists. For instance, Jamie Slaughter AC is an epidemiologist at the University of Minnesota. And she was saying because the public and the country's leaders are not taking this virus seriously enough, that quote unquote, it's a situation that didn't have to be, all these deaths. So the parts of the United States that have leveled off are the ones that are requiring masks and limiting indoor dining. So that's a wonderful thing to see. And we really do want to, at every time that we can, educate people about what your dad's doing in the ICU and what he's seeing and what the science is behind this. So every one person that you can educate is one more person that you can help. And this could even be policymakers, so that policymakers can be sent data, and you can do that. You can make a difference by calling them and by sending in letters and emails and saying, let's look at this and look at what we can do, what the rest of the world is doing, because right now the United States is leading in deaths. So we really don't want to be number one in that. That's like not so good. So anyway, one of the things that is newly available, which could help people understand how severe the virus is, even though maybe outside in the world it doesn't look like it's that bad. But so in New York, for instance, at Mount Sinai Beth Israel Hospital, their ICU capacity is at 86%. And this available data is really neat. You can find it on the Department of Health and Human Services and also with the CDC. So you can go into your area of the world and find out like how many people are in your county, and then you can find out what the number, but the ICU, the intensive care unit capacity is, and you can find out how many available beds there are, and you can also find out in your county, how many COVID-19 patients there are. So, for instance, at Mount Sinai Beth Israel this morning, their ICU is at 86% capacity. They have 73 COVID patients, and they have 6 available beds. Now, we also know in New York they have other hospitals available. So you can also look at those other hospitals and decide how strict do you really feel like you need to be. And really, I think we ought to just stay really strict for the duration. And we get these numbers down so that we can get back to normal quicker. So one of the things that happened in my county, Santa Cruz County, is we have 273,213 people in our county according to 2019 data collected. I'm not sure if that was the census, but that's 2019. So in my county, we have 4 available ICU beds right now, and our 2 hospitals are at 86%. So between the 2 hospitals, we have 4 available beds. That's it. Between one hospital has 1 bed and the other one has 3. So that's for 273,213 patients, or people. So you really want to make sure we wear our mask and socially distance and wash your hands and do the best you can to keep the numbers flat and low so that we can end this thing with the same number of people that we have today. Once everybody's vaccinated and the virus is under control. But in the meantime, let's reduce our stress levels by tapping. And we can know that this tapping meditation will reduce your cortisol levels, and it will also help you to raise your immunoglobulin levels so that you will have a healthier immune system if you get the COVID virus. So starting for Teddy, he was talking about feeling apprehension because of the situation that he's watching his dad and go to work and people not really wearing their masks. So all you can really do is do your best to stay healthy yourself. Don't give it, don't get it. Know it's airborne and deadly, and you know that. So I think what we'll do is we'll tap on that apprehension to people not really understanding that we do have control over what we can do to make this very, very serious situation easier on everybody, and to hopefully have all of our loved ones with us at the holidays. So let's start our tapping on resistance or on apprehension to feeling absolute radiant health. So we'll envision ourselves, if you could take a nice deep breath in and close your eyes, and then imagine yourself in radiant, beautiful health, and you are playing with your friends and you're running around, you're having a good time, and no mask, and you are radiantly healthy, and so is all of the world. And so now that you've imagined that, focus in on any resistance that you have inside of your body and where that resistance is. So if you're having resistance, say your heart rate goes faster, if you're thinking about this vision of radiant health, and anything that pops into your mind that says, no, I can't have that radiant health, I want you to focus on where that is in your body and give it a number. Then just write it in the sky, and then afterwards, after we're done doing the tapping, we will rate it again. So right now, let's tap on the apprehension for maintaining safety during the COVID pandemic. So repeating after me, even though I'm feeling apprehension because I can't control what other people are doing around the pandemic, I deeply and completely accept every feeling inside of me. Even though I'm having apprehension about having beautiful, radiant health in the face of COVID-19, I deeply and completely love and accept myself exactly as I am. Even though I'm experiencing stress and apprehension during this pandemic because people aren't wearing their mask when it's supposedly required, maybe they don't understand. I recognize I have this stress inside of me, and I deeply and completely love and accept myself exactly as I am. Great, Teddy. Let's go on to the inside the eye. This apprehension outside the eye, this apprehension around the pandemic under the eye, this nervousness under the nose, this fear, chin point, I'm having resistance, collarbone, to seeing myself in radiant health. Under the arm, this resistance is really powerful. Top of the head, I acknowledge this fear. Inside the eye, I'm really afraid. Outside the eye, I acknowledge this resistance. Under the eye, I really feel under the nose every emotion inside of me. Under the chin, and I deeply love myself. Collarbone point, and I have my back. Under the arm, I'm right here to nurture this. Top of the head, I'm holding myself dear. Inside the eye, I give myself emotional hugs. Outside the eye, I love myself with all these emotions. under the eye. I accept myself with all these emotions, under the nose. I accept myself with every feeling, chin point. I accept this resistance to health, collarbone point. I accept this resistance to healthy visions, under the arm. I know that tapping is reducing stress levels, top of the head, because science says, inside the eye, when I have subjective feelings, outside the eye, the markers in my biology, under the eye, reflect those, under the nose. And during EFT, under the chin, also known as tapping, collarbone point, the tapping lowers cortisol levels, under the arm, and it raises my immunoglobulin levels, top of the head. And the cortisol levels inside the eye go down with tapping, outside the eye, by 37%. Under the eye, I deserve radiant health. Under the nose, doing tapping and meditation, chin point, lowers my cortisol levels, collarbone point, and raises my immunoglobulin levels. Under the arm, my immunoglobulin levels go up, top of the head, 113% in 1 week. Inside the eye, and my cortisol levels outside the eye, which is my stress levels, under the eye, they go down 37% in 1 week. Under the nose, of tapping and meditation. Chin point, I deserve this radiant health. Collarbone point, I can do the best I can. Under the arm, I can educate policymakers and other people. Top of the head, on recent science. Yes, you can. Inside the eye, science that is peer-reviewed. Outside the eye, and evidence-based, under the eye, and credible and recent, under the nose, is based on facts, chin, that I can share with others. Collarbone point, I am that person in radiant health. Under the arm, I walk and talk in radiant health. Top of the head, I perceive and think and walk and talk in radiant health, in mind, body, and spirit. All right, Teddy, thank you for sharing your story. We'll check in later with you, and really appreciate your sharing.